Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to the weekly Redefining Medicine podcast. I am pleased to welcome Dr. George Munoz, a double board-certified internist and rheumatologist, and fellowship-trained in integrative medicine from the Arizona Center of Integrative Medicine. He possesses a wide set of additional training, including traditional Chinese medicine, acupuncture, homeopathy, energy medicine, and more. He is also the chief of integrative medicine for AARA, the largest rheumatology supergroup in the United States. Thank you so much for being with us, Dr. Munoz.
Thanks so much for having me. It's a pleasure, and really looking forward to talking with you and sharing and learning.
Dr. Munoz, why rheumatology? What initially attracted you to this particular field in medicine?
The field itself turned out to be an opportunity in rheumatology to put on our thinking cap, and it was an exercise in determining root cause of illnesses, and that really interested me. That was the first time in general medicine that I felt that we were addressing root cause illness, many of which were immunologic. And the different presentations that patients had in their illnesses varied so much. And really, it was the rheumatologist that ultimately many times was called, for example, at the hospital in residency, in my fellowship, to solve and crystallize what was really happening with patients who were very ill and who had no diagnosis. They were unknowns. Their situation medically was a big question mark. And I was attracted really to that process, the Sherlock Holmes approach in medicine, to be able to make a difference. So that's a high-level answer as to what attracted me to rheumatology and continues to be up until this day.
Dr. Munoz, you integrate a wide variety of tools into your practice. Can you share more on how Indigenous, Peruvian, Ecuadorian, and other North American practices help form the basis of the background and work?
I was able to discover through Indigenous studies, through studies of multicultures of Indigenous, Amazonian, shamans, Andean shamans, North American healers, and North American Indigenous Hopi Indian tradition, that a lot of the belief systems are actually quite universal. And one would think that for cultures that were distant physically, that the similarities would not be so significant. Learning how to understand, for example, the medicine wheel in the Inca Andean tradition and its similarity to the medicine wheel of the North American Indigenous, it became apparent that while details might differ, the general approach of energetics, of understanding that there's some form of spirituality, of energetics that we can't readily physically see, but there is intuition and there are tools to help guide and make these more subtle energies manifest and detectable, became a topic that I became fiercely interested in. And it turns out that this has really been around for millennia, not just in the cultures that I've mentioned, but also in Asia and Indian cultures. And the definition of the indigenous medicine wheel, whether it's in North or South America, really is global. So how do I integrate it, really was your question, into modern practice? I do it by subtle use. I have it at my disposal to utilize, along with the typical history that we all take as physicians, physical exam. I focus not just on the verbiage and the history, but I evaluate the energetics of a person by the methods that I've been taught over time. And I look for dysfunction in those areas, and I correlate them with the more conventional and medical model of what we would call disease states. However, I'm looking at it with a different plane, a different hologram. And it's somewhat difficult to just tell you how I do it. It's very much an experiential, individual experience. And I've become very habituated to being able to do it using the skills on and off as needed, when needed. And I also offer, outside of the conventional clinic in the Oasis Institute, we have the ability to offer patients evaluation of their energy fields and do shamanic practices. Now, this is not what is done in my usual arthritis clinic. There, it's much more conventional. We're listening to our patients, we're examining them traditionally, we're utilizing the many customary diagnostic tools. And the energy medicine actually is a diagnostic and therapeutic approach. But this takes a long time to learn how to utilize, how to incorporate. And I've just been very privileged and fortunate to have studied with tremendous global healers that have shared this information and that I've been able to glean over time and learn how to integrate into a conventional setting in practice of medicine.
Thank you. What challenges and barriers, if any, do you face with this style of practice?
So I would say that the challenges are that not every patient necessarily is interested in this. And sometimes I may see or have intuition that someone would benefit from this type of work as well, but they may be focused on a different approach because that's not something that they were thinking about, believe in, have experience with. And many times our past experiences informs our current reality. So that would be a challenge. Another challenge is that during the day for conventional medicine, we're very much in a Western mode of thinking where schedules are there to be adhered to so that the day can happen in an orderly way. In the Andes and the Amazon, time loses its fluidity, and some of these processes of healing that are ancient don't follow the 9 to 9:15, 9:15 to 9:30 scheduling, or the 9 to 5 workday. There has to be an ability to have time become less linear and more circular. So separating when I do this type of work from my conventional medicine, my conventional rheumatology and integrative medicine, really has been the way that I have found that I'm able to offer these services and this aspect of care so that it doesn't clash with the style of the conventional approach.
There has been a lot of discussion regarding building multidisciplinary clinical teams. Tell us about the Oasis Institute and how that process has looked like in action.
This has been a tremendous opportunity to build relationships with colleagues, with friends and practitioners and other disciplines. Initially started out of the concept of community and conversation and spending time together socially in gatherings outside the clinic and the actual uh, Oasis Institute time where we have patient care. What I have found is that building the interpersonal relationships with my colleagues in different disciplines was able to migrate over into actually working together in the clinical setting. And really, besides finding the root cause and approaching it, understanding that my singular approach is probably too limited. But if we open up and have a multidisciplinary approach where mind, body, spirit, nutrition, exercise, sleep, stress reduction, energetics, sound therapy, physical therapy, different forms of exercise, yoga, tai chi, energetic self-care are all interplayed, taught, and discussed when appropriate. That at that time, something kind of magical happens with taking care of the people we want to take care of. And we find that the results are enhanced, that the ability to do this in a communal, interdisciplinary way is a lot of fun. It's challenging. It's also invigorating intellectually and very satisfying when we are able to help somebody when other approaches have not yielded the results that should have been available at some point. So it's really been a journey of learning what disciplines are most important to how I work in the clinic, what do most people need and respond to, and then creating a good referral center, whether it's in your clinic or outside your clinic in your community. So you don't have to have all these disciplines in-house. As long as we form great networks with communication, excellent purpose and motive, I find that this works very, very well.
Just to piggyback off of that wonderful answer, what initial advice might you give to physicians who are looking to build a multidisciplinary team like the Oasis Institute?
So my first piece of advice would be pick one or two disciplines and just focus on that. Because if we try to add 3, 4, 5 things with 3, 4, or 5 individuals, where the focus is not going to be there necessarily, and results, communication are not kept at the forefront, it's better to just start with really just one or two individuals that you have alignment to, that you feel comfortable with, who are highly qualified, ethical, well-trained, and who want to do this. Because this is, again, one of the paths less walked, one of the not common approaches. But yet I see it in conventional medicine as well, that when we utilize multidisciplinary approaches, that the outcomes are better, people respond better, and the healer has a different and amazing experience in comparison to being in an isolated silo. I think that that approach, the isolated approach, the singular approach, suffers from the ability to get common core, village energetics, and different set of views and interpretations that only help in resolving or solving the diagnostic and therapeutic questions.
You've served as a clinical professor for over 25 years now. What gaps in education and other predominant roadblocks do you notice today?
The main gaps in knowledge that I see are very basic and have to do with, for example, nuances, specifics of diet, nutrition, its effect on inflammatory diseases, the impact on the microbiome, the impact of mind-body medicine and stress reduction, and simply understanding that there are maneuvers that we can all utilize, employ in our daily practice that make a big difference. But I would say that nutrition, diet, understanding supplementation with a specific indication as opposed to a shotgun approach, and not understanding, again, nuance of how, when, and what supplements and nutraceuticals are needed depending on the medical condition, pharmacotherapies, or deficiencies that we are able to define. These are basic areas that I think need to be addressed more in conventional medical education at all levels, including the ones that I spoke to you just now about.
Thank you so much for being with us, Dr. Munoz.
Thanks so much for having me.